There's been a dramatic increase in the number of gender-based violence victims seeking help. That's according to Lifeline. The organisation says it's received dozens of calls from distressed citizens. Chief Director Caesar Mahangwe from the Development Department, responsible for gender-based crimes, joins us to discuss this. And she's talking to us from Johannesburg. A very good morning to you. Tell us what you are seeing.
Good morning, and good morning to you and your viewers at home. Firstly, the article that Lifeline released, I'm not sure about the stats, how they generate their stats, because it's different from what we have witnessed. Because we also run a call center, we call it a gender-based violence command center. Since the lockdown, yes, of course, we have witnessed volumes of calls, in terms of seeking help, in terms of GBV-related cases, as well as non-GBV cases. So just to share with you, before the lockdown, which is from March, the 1st of March to the 26th of March, we have received plus minus 10,000 calls. And during the lockdown, from the 27th to the 30th of April, we have received 22,000 calls. So, of course, there is a 50% increase. And because of the COVID-19 places serious demand on our psychosocial services.
Okay, because the numbers you mentioned, Lifeline was quoting a 500% increase in 80,000 calls. But you're saying it's a lot less than that. But at 50%, still a staggering number. What is it that you're hearing? What are some of the distress messages you are receiving?
Yeah, people are experiencing anxiety. They are anxious. They don't know how to deal with this, how to protect themselves. Of course, they are taking reasonable measures. However, one cannot be certain that this cannot happen to you. They are, especially the youth, they are experiencing depression. They don't know what to do with their time, how to deal with it, and all of that. So it's more on, anxiety, trauma that people are going through, and as well as what to do, how to support people or family members that are affected or infected.
And what are you telling them?
There's quite a lot. We provide them with counseling. We share with them coping skills, things that they can do with their time. It's a reflection time. It's not only about you going out, but you need your you time so that you understand exactly who you are and how best, you can do certain things that you never maybe had an opportunity to do. Spend time with your journal, write down your feelings, how you feel about it, get in touch with who you are. So those are some of the things. But the cases in relation to gender-based violence, what we normally tell the victims, there are 4 things. We say, number 1, it's important that they must break the silence, because remember, when violence takes place or domestic violence, people keep it, between themselves. It's something that is happening in a household. Nobody knows about it, but we are encouraging them to say, break the violence. It's important that you inform the significant others so that they may be able to avail help when you need it. Number 2, we are saying report the abuse, not only to the police, because sometimes when we say report the cases, people thinking that we're talking about police stations. We're not. We're saying you can report the abuse at a local clinic, you can report it at the hospital, NGOs, as well as employee wellness practitioners at the workplace. They do have practitioners who are able to assist you and link you with the police. So those are the things. The third one, we are saying it is important that survivors or victims, they must know the resources available in their areas. For instance, know whether you've got an overnight shelter, the crisis center, the shelters, as well as the support groups. Those resources are quite key, because when you need help, then you know where to go to. The last one, we're saying, and know the call center numbers in the country. We've got the Lifeline, as we've said, we've got our own gender-based command center, the number which is 0800 428 428. It has also a capability of please call me, the Skype, as well as the SMSs.
All right. Good advice there. And that number again, 0800 428 428. You're also focusing on men. Tell us a little bit about that.
Yes, men. We are also working with Men and Boys Assembly. We've been going around in all 9 provinces conducting those men and Boys Assembly, where we are saying for us to really fight and break the cycle of violence, we need to work with men. We cannot isolate men. They need to be part of us to fight the scourge. So we're talking about their feelings. Most of them, they don't want to express how they feel. So we're beginning to say it is okay, it is normal for you to express your feelings without necessarily fighting or expressing them in a physical way. So we do engage them on that, and we do try to deal with the traumas that they've also experienced during their childhood, and we refer them for further counseling and intervention.
Siza Magangwe, very good to have you with us this morning. Thank you.